the lower limbs. So your this module, mind and movement, is about the mind and the movement. Mind is all about your brain, spinal cord, cranial nerves, and peripheral nerves. And the movement is mostly done by the lower limb. So today we are going to have a small tutorial about the lower limbs. You have already finished the four gates, the gate 1, 2, 3, and 4, where you have learned about the bones, joints, muscles, different vessels, and important structures of the lower limb. Now, what is the main objective of this tutorial? Basically, we are going to see the different bones of the lower limb. And if there is a bone, there is also the joints. So a skeleton and the joints of the lower limb and the muscle group, uh, different kind of muscles of the lower limb. And lastly, it's not a big topic, the major vessels and nerve. So out of these three objective, the major objective is the muscles group of the lower limb. Why I'm saying so? Because what are the things you need to know in a muscle? The first is that their origin insertion. So for that, you have to know about the bones. So say you just read the muscles of the lower limb. There is just one objective, and that is the muscles group of the lower limb. So what are the things you need to know about that particular muscle? Their origin insertion. For that, you have to know about the bones. And one of the function of the muscles are is the movements. So for the movement, you have to know about the joints of the lower limb. And then um, there are nerves and the vessels which supply the muscles. So we also have to know about the nerve supply and the blood supply. So we can say that the major objective of this tutorial is to know about the different muscle group of the lower limb. And to complement that, we also have to know about the bones because we have to know their origin insertion, the joints because we have to know about the action of that particular muscles and the blood supply and the nerve supply. So we'll focus mostly on the muscles, and side by side, we will also know about the bones as well as the major vessels and the nerves. So this is what we are going to learn today. Before we start our discussion, tomorrow on Tuesday, you are having the last session, and I request all of you, both in the male side and the female side, to go to the college and explore the different specimens you have in the lab. You have already finished it. You don't need anybody, but if you want someone, you can have it. You go and explore all the bones, muscles, joints, everything. Because now this lower limb is going to be in your final exam. We'll have one OSCE station, that is integrated stations, and then you will have the questions of the lower limb in your MCQ and the MEQ also. So it's going to be in your final exams in all the different types of exam, the OSCE, the MCQ, and the MEQ. Okay, so go to the fine. As I told you, the major objective is to know about the different muscles group of the lower limb, and for that we have to know about the bones of the lower limb. So now, what are the bones we have? We'll start with this bone. This is the hip bone. Now there is one more thing that is comparative anatomy. What is that? All of you have learned about the anatomy of the upper limb in year two. Last year you had a, you know, it's all discussion about the upper limb. So you already finished the upper limb, and where you have learned about the different types of muscles, the bones, the joints, everything. So the anatomy of the lower limb is very much similar to the anatomy of the lower limb. So it's good idea to always revisit your previous knowledge. And that's, you can compare the anatomy of the lower limb with the upper limb, and it's also going to help you. So the structure is very much similar. We'll see that how you can compare that. So let's start with this bone. This is the hip bone, and this is very much similar to your scapula. Now, you also finished this bone in your second year, I think, anatomy of the pelvis. I'm not going in the detail of this bone. So, what is the purpose of reading this bone here? as I told you, that major objective of the lower limb is to know about the different muscle group. And this bone, uh, this one of the major bone which provides attachment to the lower limb muscles. Okay. So for that purpose only, we are going to read about these bones. Now, this bone, for that purpose, we can divide into three different components. Uh, the medial component, this bone, that is the pubis. Now you can see this bone is in anatomical position, and in this anatomical position, you can say that it has three different parts. So this is the medial part. What is the medial part? The pubis. The most medial part of this bone is the pubis with the superior and inferior ramus. Then we have the posterior part of this bone, which you can see from here, and this is the ischial tuberosity. So it has the medial part, which is pubis. It has the posterior part, which is ischial tuberosity, and then it has anteromedial or anterior part, which is the iliac bone, the anterior surface of the iliac bone, and then these two anterior superior and anterior inferior iliac spine. Now, why we are dividing this into three different parts, the medial part, the posterior part, and the anterior part, because you have already learned that in the thigh region, we have three different regions, three different muscle group or three different compartment in the thigh. What are the compartment? We have the anterior compartment, we have the medial compartment, and then we have the posterior compartment. Okay, so we are going to see the different muscle group. As I told you, the major objective of this tutorial is to know about the muscles. So as I told you that we have three different muscle group: the medial group, the anterior group, and the posterior group in the thigh. So what we have to know about that? We have to know about their origin, their insertion, their action, and the nerve supply. So I'm dividing this bone into three different parts, and one is the medial part, the posterior part, and the anterior part, for the purpose of the origin of the three different muscles group of the thigh. For example, we have a medial group of muscle, and the medial group of muscle, they are adductor, because the major function of this medial group of muscle would be the adduction automatically, because they are on this side. So when these muscles will contract, they will do the adduction. So the medial muscle, they are adductor muscles. So if somebody will ask you, what is the origin of any adductor muscle like longus, magnus, and brevis? So the origin is from the medial part of this bone. The medial muscles of the thigh will take origin from the medial part of the hip bone, and that is the pubis. We just want you to say the pubis, yani the pubis with the superior inferior ramus. This is for sorry, this is for the medial muscle. So you can say the pubis because it is the medial part. Now coming to the posterior part, what do we have here? We have the ischial tuberosity. As I told you, this is the posterior part. So for the posterior muscle that we used to call as hamstring muscle, origin is from the ischial tuberosity. And for the anterior group of muscle, the one is the iliacus, then we have here the sartorius, and we have the rectus femoris. They are from the anterior part of the bone. So three major component of the thigh from the three different parts of the hip bone. The medial part of the hip bone is for the medial muscle. The posterior part of the hip bone, that is ischial tuberosity, is for the posterior group of muscle, and then anterior superior, anterior inferior, and the iliac fossa is for the anterior group of muscles. So how the question could be asked for this? Like say they can ask you that what are the name the muscles which are attached to the ischial tuberosity. So you have to name all the muscles of the hamstring group. What are the hamstring group of muscles? They are semitendinosus, semimembranosus, biceps femoris. All the long head of the biceps femoris. The origin of all these posterior muscles are from the ischial tuberosity. So this is the hip bone. Next to the hip bone, uh, we have this. What is this bone is? This is femur. So now, as I told you that this hip bone is like the scapula of the upper limb. Similarly, this femur is like humerus of the upper limb. This is the bone of the thigh, and that is the bone of the arm. So what kind of bone it is? similar to the humerus. It is a long bone. What are the parts of a long bone? It is having the upper end, the lower end. In between these is shaft, and then there is a neck which connects the head with the shaft. Now, what are the other important structure do we have in the femur? Like humerus, there we have two tubercle, the greater tubercle and the lesser tubercle. Here we have two trochanter. Now compare the this bone with the femur with the humerus. Femur is the largest bone of the body, so you will see the structure bigger than the humerus. So the smaller the part in the humerus, that we call it as tubercle, the greater tubercle and the lesser tubercle. Now here it is, you will see it's large, so we call it as greater trochanter and the lesser trochanter. These are two very important bony landmarks here in the femur, the greater trochanter and the lesser trochanter. And then we have a line which connects these trochanter, we call intertrochanteric line, which is anterior, and posteriorly it's a crest, so we call it as an intertrochanteric crest. So these are two important bony landmarks. Now, what we have to remember is some important bony landmarks. Like say, as I told you, ischial tuberosity is one here. Similarly, we have the greater trochanter and lesser trochanter. You might be asked about the structure which are attached to these important bony landmarks. So you may be asked that what muscles are attached to the lesser trochanter. Similarly, what are the muscles which are attached to the greater trochanter? Greater trochanter, if you go and you will see, it has the lateral surface, the medial surface, and the superior border. And here you will see the lesser trochanter. Okay, now let's see the shaft of the humerus. And in the shaft, you will see there is only one border, and this border is called linea aspera. This is not in the anterior, this is in the posterior. So posteriorly, you will see there is only one border in the femur, and that border we call it as the linea aspera. Why we call it as a linea aspera? Because it has two lip. One is your medial lip and one is the lateral lip. So you will see that the medial lips. So what is the purpose of this border is because it provides attachment to the muscles. So as I told you that the linea aspera is having two lips, one on the medial side and one on the lateral side. So the medial muscles will be inserted over the medial lip, and then the lateral muscle will be inserted over the linea aspera that we will see. So linea aspera is again important. Now you have to know about the linea aspera. What are the muscles group which are attached on the linea aspera? Now, uh, just think about it, that what are the muscle which should be attaching to the linea aspera? It is anterior or posterior? It is posterior. So of course the posterior muscle. Now in posterior group of muscle, we have two type of muscle, one on the medial side and one on the lateral side. So their origin is from the ischial tuberosity, like hamstring group of muscle. So all are coming posteriorly, and then we have they're attached on the medial lip. So we have here adductor group of muscles. So these muscles are attached on the medial lip, and then we have the biceps, which is on the lateral side, attached on the linea aspera. So this is an important line. This is an important border for the femur, linea aspera, and you should know about it. Now let's go to the lower end, and in the lower end you will see what similar to the humerus. We have condyles here and the epicondyles. So we have lateral and medial condyles, and then we have in these two we call it as intercondylar fossa. Now, when you trace this linea aspera down, on the medial side, you will see one tubercle here. And this tubercle is known as adductor tubercle. So see this, this is the medial lip, and the medial lip is going towards the medial condyle. And just above the medial condyle, there is a tubercle, and that tubercle is called adductor tubercle. As I told you before, that this medial side is for the medial muscles. And what is the medial muscle? We have the adductor muscles here. So this is the adductor tubercle, and here we have the attachment of one of the important group adductor muscle, that is adductor magnus. So You should know about the linea spera and you should also know about the adductor tubercle. Now let's go to the bones of the leg. Before that, sometime you have to know what is the thigh, what is the thigh, then what is the leg. So the thigh is the area between your hip joint and the knee joint, and the leg is the area between the knee joint and the ankle joint, and the foot is the area distal to the ankle joint. So the lower limb is divided into three different regions: the thigh, the leg, and the foot. So what is thigh? It is the area between the hip joint and the knee joint. The leg is between the knee joint and the ankle joint, and the foot is distal to the ankle joint. Now let's go to bones of the leg, and we have two bones. The medially we have the tibia, and laterally we have the fibula. Again, these two are long bones. Now let's see the tibia first. So tibia again is a long bone. It has the upper end, the shaft, and the lower end. Now what are the features do we have in the upper end? Two condyles, intercondylar eminence. And then just we have one anterior border, we have the medial border, we have the lateral border. So we have three surface. This is the medial surface, which is subcutaneous. There is no attachment of any muscle in the on the medial surface. And then we have the lateral surface. Uh, in upper part of the anterior border, there is a tuberosity here. So this tuberosity is called the tibial tuberosity. Again, you can go and see about this tibial tuberosity. And in the lower end, you can see medially it is little prolonged and we call it as medial malleolus. So you can see the medial surface here, you can see the lateral surface here, and now let's see the posterior. This is the posterior surface, and in the upper part of the posterior surface, there is a line. And this line is for the attachment of a muscle, which is going toward the sole, and we call this line as a soleal line. So this is your tibia with the upper end, the lower end, and the shaft. Now, fibula again is a long bone which is having the upper end, the shaft, and the lower end. The lower end is again prolonged to form a lateral malleolus. So lateral malleolus is a part of the fibula. Medial malleolus is a part of the tibia. The upper end is called the head, and the top of that head is we call as a styloid process. And then again we have the neck here. So this is your fibula and this is your tip. Now let's see the bones of the foot. What is foot? The area distal to the ankle joint. So what are the bones of the foot? This skeleton might be given to you and they'll ask you to identify the different bones of the foot. So please remember, go today, tomorrow and explore the bones of the foot. So what are the bones we have? We have tarsal, metatarsal, and phalanges. Mainly, you have to know about the tarsal bones. So this bone is your heel bone, and we call it as calcaneum. And top of the calcaneum, we have this bone which form the ankle joint. This is called talus. Now, there is one bone in front of the talus that we call as navicular. It's a boat shaped, and this is the head of the talus. So now this is the cavity in the navicular bone, and this is the head of the talus. So this joint between the head of the talus and the concavity of the navicular is one of the example of ball and socket joint. So just go and see this ball and socket joints. We have some very important movement here. So this is your talus, and in front of the talus, we have the navicular bone. And in front of the navicular bone, we have three cuneiforms: the medial cuneiform, intermediate, and the lateral cuneiform. And there is one bone anterior to the calcaneum that we used to call as the cuboid. So these are the bones, the tarsal bones. You should go and you should identify these tarsal bones tomorrow in the DR room. Then these are the tarsal, and then we have the metatarsal and the phalanges. Not very difficult, and but just to identify these, so very important. Now, when we talk about the foot, there is one very important thing, and that is the arches of the foot. It's not flat. It's not flat. The foot is not flat. Rather, it has arches, and we call it arches of the foot. We have two longitudinal, one is on the medial side and one on the lateral side, and then one is your transverse arch. So how this arch is formed? Now, if you can see the shape of this bone, it is wedge. It is not four-sided, rather it is wedge. So when the shape of the bone is wedge, other bones which are attached to this, it forms an arch. So for each arch, there is a key bone. Key bone means that bone is a wedge-shaped bone, and when on that bone other bones are attached, it forms the arch. So we have three arches, two longitudinal, one transverse, and for each arch, we have one key bone. Key bones means it is a wedge shaped. When I say wedge shaped, and it's not flat on all the side, and other bones when comes together attached to this wedge shaped bone, it forms an arch. Okay, so for each arch, there is one key bone. What are the bones which form the arch? For the medial arch, we have the medial side of the bone, medial side of the tarsal bones. So what are those? We have the calcaneum. Calcaneum is there. Yeah, if you can see the calcaneum, it is having the lateral part and the medial part, and this is contributing to both longitudinal arch. And then on lateral side, you can say there is a calcaneum, and in front of the calcaneum is cuboid and fourth and fifth metatarsal. Similarly, on the medial side, we have calcaneum, talus, navicular, three cuneiform, and first three metatarsal. Transverse arch is formed by the base of all the metatarsals, cuboid, and three cuneiform bones. So the first thing about the arches that you have to know the different bones forming these arches. Now, as I told you that the first very important thing about the arches is the key stone, the key bone. So for each arch, you will see there is a key stone or the key bone. So let's see about this key stone. What is this? This is the talus. So this is, look at this shape. It is a wedge shape. So when other bones are coming together, they are forming an arch. So this talus is key bone for the medial longitudinal arch. Similarly, you have for the transverse arch, we have this cuneiform, which is forming the uh, key bone for the transverse arch. Okay. Uh, so what about the lateral longitudinal arch? The key bone is your cuboid. So now, once arch is formed, an arch is how this arch is formed by the shape of the bones. Look at the shape of the cuboid, the talus, and the intermediate cuneiform. They all are wedge shaped, and because of this wedge shaped bone, the arch is formed. Now, once this arch is formed, you need to maintain it. So how it is maintained? You need to attach these bones together by short ligament and the long ligament. So these are, different short and long ligament which are putting the bones together. And then we have, something pulling it from above. What are these? These are the tendons of the long muscle. You have seen on the medial side, we have the tendon of flexor hallucis longus, and on the lateral side, we have the peroneus longus. So these bones are actually pulling it from above and maintaining it. So there are two things about the arches. One is how this arch is formed. What are the bones which form the arches? What are the key bones for each arch? So you have to remember the talus, the cuboid, and the intermediate cuneiform. Then how these arches are maintained. So you can see these are the factor maintaining the arches. Shape of the bone, in inferior edge of the bones are tied together by the ligaments, and then these arches are suspended from above by the long tendon of the muscles, flexor hallucis longus and peroneus longus. Now, once we finish the bones, we'll go to the joints of the lower limb. What are the joints we have? Let's start with the hip joint. So again, I told you that when you are reading the lower limbs, it's always good idea to go back to upper limb. So hip joint is very much similar to your shoulder joint. So what kind of joint is this? This is a ball and socket joint, very much similar to your shoulder joint. So what is the socket? The socket is formed by the acetabulum of the hip bone, and the head is formed by the femoral head. So this is the femoral head is forming the ball, and the socket is formed by the acetabulum. So it's a ball and socket joints. And what are the ligaments? So in joints, what are the things we need to know? We have to know about the bones. First, we have to know about the type of the joint, what type of joint it is. So it's synovial hinge joints. The next thing is about the ligaments. What are the ligaments? Because the joints are put together by the ligaments. So we have to know about the different ligaments. And then we have to know about the different movements of the joints. So this is hip joint. This is an example of synovial ball and socket joints. And now what are the ligaments do we have? You have already learned about it, but just a revision that we have here, the acetabulum labrum, very much similar to what the glenoid labrum, which you have seen in the shoulder joint. Then there is a ligament coming from the head. We simply call it as the ligament of the head of the femur. Now, apart from these two, we have each ligament coming from the three different parts of the bone, from the pubis, from the ischium, and from ilium to the femur. And we call it as iliofemoral, ischiofemoral, and pubofemoral ligaments. Movement we'll see later after we finish the muscles. So just now, what kind of joint it is, what are the bones forming the joints, and what are the ligaments. Now let's go to the very important joint of the lower limb, and that is the knee joint. Okay. Now, again, what are the things you have to know? You start with the type of joint. It's a synovial hinge joint. The knee joint is synovial hinge joints. What are the bone forming the knee joint? It's the lower end of the femur, like two condyles, and upper end of the tibia with the patella. Fibula is not contributing to the knee joint. So these are the bones forming the knee joint. Okay, now let's see the ligaments. What are the ligaments here? It's a synovial hinge joint. So we have a capsule here, and the ligaments are some ligaments are inside the capsule and some ligaments are outside the capsule. So we divided these ligaments as extracapsular ligament and intracapsular ligament. So what are the extracapsular ligament? We have on one ligament on the medial side, one ligament on the lateral side. So there is a joint in the center and two ligament on the side. So these are called collateral ligament, medial collateral and the lateral collateral ligament. And then we have one ligament coming from the front that you have already seen that this is the patellar ligament, and one ligament on the behind which is obliquely placed. We call it oblique popliteal ligament. So these are the four ligaments. And then inside the capsule, we have four ligament. Now there is an important thing. We have two cruciate ligament. Cruciate means they're crossing each other. So one is called anterior cruciate ligament and one is called posterior cruciate ligament. And then we have two menisci. Menisci, actually, they are not ligament, they are fibrocartilage, they are cartilage. But for the purpose of understanding, we have divided this into intracapsular ligament. So in some book, you will see that they are mentioned as the cartilage, and in some book, you will see that they are mentioned as intracapsular ligament. So they are cartilage, but we are classifying them as intracapsular ligament for the purpose of reading only. So we have two extracapsular ligament and four extracapsular ligament and four intracapsular ligament. Now, just concentrate one thing that we have two cruciate ligament, anterior cruciate and the posterior cruciate ligament. Now, just see the anterior cruciate ligament. It is attached to the anterior part of the tibia and the posterior part of the femur. Similarly, the posterior cruciate ligament is attached on the posterior part of the tibia and anterior part of the femur because they are cruciate, they are crossing each other. So why we are calling one as anterior and one as a posterior? The classification here is based on their attachment on the tibia. So one which is attached anteriorly on the tibia, we call it as anterior cruciate ligament. They are not named because of their attachment on the femur. They are named anterior and posterior because of their attachment on the tibia. So anterior cruciate ligament means this is attached on the anterior part of the tibia, and the posterior cruciate ligament is attached on the posterior part of the tibia. So they are cruciate. So one end is attached on the anterior part of the tibia, and the another end is attached on the posterior part of the femur. So when I say what is the attachment of the anterior cruciate ligament, it is attached on the anterior part of the tibia and the posterior part of the femur. Where on the femur? See, this is your lateral condyle and on the medial surface. And the posterior cruciate ligament is attached on the medial condyle on the lateral surface. So for the purpose of understanding, anterior cruciate ligament is called anterior because of their attachment on the tibia. It is attached anteriorly, so it is called anterior cruciate ligament. And similarly, you will see the function of anterior cruciate ligament. It prevents the anterior movement of the tibia, right? Because it is attached on the anterior part of the tibia. So when you pull tibia anteriorly, it will prevent the anterior dislocation of the tibia on the femur. Similarly, for the posterior cruciate ligament, it is it is preventing the posterior displacement of the tibia. So these two ligaments are very important. In this case, you have seen also that the anterior cruciate ligament injury is very common. So how you are going to examine, how you are going to test the anterior cruciate ligament? This is called anterior drawer test. So what is anterior drawer test? You put the patient knee in a flexion, and then you pull the tibia anteriorly. So when you see that there is an injury to the anterior cruciate ligament, you can easily pull it anteriorly. And in case of posterior cruciate ligament tear, you can easily pull pull it posteriorly. So you remember these two ligaments, very, very important ligament, and the function of these two ligaments, and how you are going to test these two ligaments. We have anterior drawer test for anterior cruciate ligament, and we have posterior drawer test for the posterior cruciate ligament. So these are the ligament, and these are the extra ligament. There is one very important thing, that is the intracapsular and extrasynovial. What is this meaning? Remember again, uh, intracapsular and extrasynovial. So now I told you that we have four intracapsular ligament, two cruciate ligament and two menisci. But these cruciate ligament, they are intracapsular but extrasynovial. And how you are going to understand this? Now, uh, now see that there is a capsule here, and inside the capsule we have the synovial membrane. So synovial membrane cover like this, and then it comes behind the posterior cruciate ligament, and then again it's covered like this. So although it is inside the capsule, but it is outside the synovium. Only these two cruciate ligament. So for these two ligaments, we call it that these are intracapsular but extra synovial. Now let's go to the joints of the ankle and foot. We have this ankle joint, which is formed by the lower end of the tibia and the fibula, which form the ankle mortise, and the upper end of the talus. This is how this ankle joint is formed. Remember, the fibula is not forming your knee joint. So this is ankle joint, which is formed by the lower end of the tibia and fibula and the talus. And this is again a hinge joint. So we have only two different kind of movements possible here. Hinge synovial joint, we have dorsiflexion and the plantar flexion. Now, apart from this ankle joint, we have the joints in the foot. We have mainly the transverse tarsal joint. What is transverse tarsal joint? The joint between calcaneum and cuboid. This is called calcaneo-cuboid joint, and the joint between talus and navicular. This is called talo-navicular joint. Remember, as I told you, that there is a head of the talus, which is forming a ball and socket joint with the concavity of the navicular. So this is one of the example of the ball and socket joint. So we have calcaneocuboid joint and talo-navicular joint. Now, what movement do we have here at the transverse tarsal joint and subtalar joint? We have inversion and eversion of the foot. Remember, these four movements are very important. Two movements at the ankle joint, that is dorsiflexion and plantar flexion. So you just don't have to know about it only, rather you also have to demonstrate it in the exam. As I told you that lower limb is there in your OSCE exam, they might ask you to demonstrate these movement, how you are going to perform the dorsiflexion and plantar flexion of the foot, as well as inversion and eversion of the foot. So you should know these four different kind of movement. Again, I repeat that the dorsiflexion and plantar flexion are at the ankle joint, and the inversion and eversion of the foot is at the transverse tarsal joint. So these are very, very important movements. So you may be asked to demonstrate, you may be asked to name the muscles, name the joints for these important movements. So be very clear about these things. Again, I repeat, there are four different kind of movements. One is your dorsiflexion, which is extension, and plantar flexion, and then we have inversion and eversion of the foot. Everyone should know about these four different kind of movements, the joints, the muscles for these movements. As I told you that inversion and eversion takes place as subtalar joint. Subtalar is posterior talocalcaneal joint. This joint, I'm talking about this joint, this is called subtalar joint. And transverse tarsal joint. What is transverse tarsal joint? Talo, calcaneonavicular, and calcaneocuboid joint. Now, look at this joint. This between the calcaneum and cuboid is called calcaneocuboid joint. And here we have a single joint between the talus and navicular and talus and calcaneum. So this is called talo calcaneonavicular. Talo calcaneonavicular and calcaneocuboid. These are transverse tarsal joint, and this is subtalar joint. For subtalar and transverse tarsal joint is for what movement? Inversion and eversion of the foot. Very, very important. Now, ligaments, as I told you that when you are reading about the joints, you have to know about the ligaments, because the joints are formed by the ligaments. What is joint? Joint is uh, articulation between two or more than two bones, and this articulation is with the help of what? With the help of the ligament. There is a tendon which connects the muscle with the bones, and there are ligaments which connects the bones together. So when the bones comes together, they forms at the joint, and they are kept together by the ligaments. So we have to know about the ligaments of the lower limb. So when we talk about the ligaments of the lower limb, you have to know about the joints of the lower limb. And what are the major joints we have? We have the hip joint, we have and we have the ankle joint. What joint? As I told you that there is a ligament of the head of the femur that you have seen, and then we have three ligaments coming from the three different part of the hip bone, from the ilium, pubis, and ischium. They are called iliofemoral, pubofemoral, and ischiofemoral. And then there is a transverse acetabular ligament. Remember, there is acetabular labrum, that is a cartilage. Okay, and the two end of the acetabulum labrum, they are connected with each other by the ligament. So that ligament is called transverse acetabular ligament because of this position. So we have five ligaments here in the hip joint. And as I told you that knee joint, we have extracapsular and intracapsular ligament. Extracapsular means outside the capsule. And what are the ligaments? Ligamentum patellae. That is uh, from the patella to the tibial tuberosity. Then we have collateral ligament, one on the medial side, one on the lateral side, and one ligament which is obliquely placed behind the knee, we call it as oblique popliteal ligament. So these are the extracapsular ligament. Intracapsular ligament, we have two cruciate ligament, the anterior and the posterior cruciate ligament, and two menisci, one on the medial side, one on the lateral side. Remember that these menisci are not true ligament, they are cartilage. But for this purpose, we have divided the ligament into the extra and the intracapsular ligaments. The ankle joint, we have two ligaments, one on the medial side, we call it as a medial ligament. Another name of that is the deltoid ligament, and one on the lateral side, we call it as a lateral ligament. Now, very important part of the joint. So for each movement, we'll see what are the muscles do we have and what are the movements at a particular joint. So what are the joints we have? We have the hip joint, which is what kind of joint it is, the ball and socket joint. We have the knee joint, which is a modified hinge joint, ankle joint, which is a hinge joint, and then we have subtalar and transverse tarsal joint. Now, hip joint is a ball and socket joint, so we have all different kind of movements are possible, like your shoulder joint. We have flexion, we have extension, we have abduction, adduction, medial rotation, and lateral rotation. Now, this is a task for you that what are the muscles produces each kind of movement. Now let's see the flexion. So the flexion of the hip joint will be produced by which muscle? The muscle which are anterior to the joint. So anterior muscles, what anterior muscle we have? We have the muscle coming from the iliac fossa. And what we call it that muscle? Iliacus. As I told you that we have anterior group of muscle from iliac fossa and also from anterior superior and anterior inferior iliac spine. They are crossing anterior to the hip joint, so they are responsible for the flexion. The most important flexor of the hip joint is iliopsoas. What is iliopsoas? One is your iliacus, that is coming from the iliac bone. Remember, this is anterior to the joint. And one is the psoas major muscle, which is actually a muscle of the posterior abdominal wall, but it is coming anterior to the hip joint, and then it is going to attach to the lesser trochanter. So the iliopsoas muscle, which is the iliacus and the psoas major, is going anterior to the hip joint, and these two muscles are attached to the lesser trochanter. Again, as I told you, that the important bony landmarks are very, very important, and one of them is your lesser trochanter. And on the lesser trochanter, we have the attached sauce as sauce major. They are attached on the lesser trochanter. They are passing anterior to the joint, so they are the main flexor of the hip joint. Now, what about the extension? Extension is the backward movement of the hip. So that is done by posterior muscle. We have what posterior muscle do we have? We have the gluteus muscle, gluteus maximus. So that is mainly responsible for the extension. Then we have abduction. What muscle we have abduction, which is on the lateral side, and on the lateral side we have the gluteus medius and minimus. Gluteus medius is like your deltoid. So you remember the function of the deltoid, that is the main abductor of the shoulder joint. Similarly, here we have the gluteus medius and minimus, that is mainly responsible for the abduction. And for the adduction, we have the adductor muscle. What adductor muscle we have? We have adductor longus, magnus, brevis, and gracilis. And then we have the medial rotation and we have the lateral rotation. The lateral rotation is by the short muscles. Which short muscle? Short muscle of the gluteal region. Uh, I will come to that. But now just remember that we have in the gluteal region, we have the gluteal muscles, that is gluteus maximus, medius, and minimus, and tensor fasciae lata. And then we have the short muscles. Once you remove the gluteus muscle, you will see the short muscle, that is piriformis, two gemellus, obturatus, and quadratus femoris. So these are responsible for the lateral rotation. Medial rotation is done by the anterior fibers of the gluteus medius and gluteus minimus. So this is about the hip joint, because it's a ball and socket joint, so all different kind of movements are possible here. The knee joint is a modified hinge joints. So mainly we have like flexion extension, and then we have some kind of medial as well as the lateral rotations. Now, why do we have medial rotation and lateral rotation on the knee joint? Because if you go tomorrow to the DR, just look at the medial and lateral condyle of the tibia. You will see they are not of the similar size. So because of the different size, we have a medial rotation as well as the lateral rotation of the knee joint. So the flexion, what is flexion? Flexion is the backward movement of the knee joint, and the extension is the front movement. So which muscle we have anteriorly? We have the quadriceps muscles. Quadriceps, we have what are the muscles in the quadriceps? We have four muscles, three vasti and one rectus femoris. Lateral and intermedius and the rectus femoris. They are quadriceps femoris, and this muscle is the main extensor of the knee joint. Similarly, for the medial and lateral rotation, we have muscle which is on the medial side and the lateral side. Like the medial muscle, we have semitendinosus, semimembranosus, and the lateral muscle is the biceps femoris. So this is your movement at the knee joint. Dorsiflexion is extension, which is the anterior movement of the ankle joint, and is done by anterior muscles of the leg, and the plantar flexion is done by the posterior muscle of the leg. Inversion and eversion. Inversion is the medial movement. So it is done by the medial muscle, and eversion is the lateral movement. This is done by the lateral muscle. We'll see this muscle one by one. Now let's see the thigh, different compartment of the thigh, and then we'll see the different muscles. So in thigh, we have only one bone, and that is the femur. So with respect to that, we have divided this into anterior compartment, posterior compartment, and the medial compartment. So we have only three compartments in the thigh. We'll see what are the different muscles grouped. Before that, we have also one region just above the upper part of the posterior compartment of the thigh, and that is the gluteal region. As I told you that in the thigh, it consists of two region. One is the thigh proper, which is having three region, anterior, medial, and posterior. And then we have also the gluteal region. The gluteal region is just above the posterior part of the thigh. So what muscle we have in the posterior compartment of the thigh? We have semitendinosus, semimembranosus, and biceps femoris. Just above this, we have the gluteal region. And in the gluteal region, we have the gluteus maximus, medius minimus, and tensor facial artery. The anterior compartment muscles, we have what muscle we have? We have, I told you, iliopsoas, which is having iliacus and psoas major. Then we have sartorius, and we have the quadriceps femoris. Quadriceps femoris again is consisting of four muscles, three vastus and one rectus femoris. The medial compartment, they are adductor compartment. So we have adductor longus, magnus, brevis, and obturator externus, and also the gracilis. So these are the medial compartment. This is your anterior compartment, posterior compartment, and above the posterior compartment, we have the gluteal region. Now, what nerve we have? We have three nerves. You must have seen that three nerves. One is the nerve which is in the anterior compartment, and the obturator nerve which is in the medial compartment, and the sciatic nerve having two parts, the common peroneal and the tibial part in the posterior compartment. So these nerves supply the same group of muscle. The femoral will supply the anterior, the obturator will supply the medial, and the sciatic with the tibial nerve and common peroneal nerve will supply the posterior compartment. Now let's see the different muscle group of the thigh. Okay. In the anterior compartment, what muscle we have? We have the iliacus, that is coming from the iliac bone. Then we have the psoas major, which is coming from the posterior abdominal wall, that is called psoas region. So because it is coming from the psoas region, we call it as a psoas. Then we have one sartorius muscle, which is coming from anterior superior ankle spine. And then we have the quadriceps femoris. Femoris is for the femur, and quadriceps is having forehead. This quadriceps femoris, three vastus and one rectus. One rectus femoris and three vastus medialis, intermedius, and vastus lateralis. And then we have one muscle that is called pectineus. So actually, pectineus is a muscle of both anterior compartment and the medial compartment. Why so? Uh, because pectineus, the origin is from the pubis. So I have already told you that the medial compartment muscle takes origin from the medial part of the hip bone, that is the pubis. So similar to that, the pectineus muscle is also taking origin from the pectin of the pubis. So we call it as a pectineus muscle. But the insertion is just below the lesser trochanter. So the origin is from the medial compartment, but the insertion is on the anterior compartment. So we put it in the anterior here. In some book, you might find that this pectineus is placed under the medial compartment. So don't worry about that. So what is the nerve supply of this anterior compartment muscle? As I told you, this is the femoral nerve, except the psoas muscle, which is supplied by the lumbar plexus. Why? Because this psoas muscle is actually the major muscle of the posterior abdominal wall, and the nerve of the posterior abdominal wall is the lumbar plexus. So psoas is supplied by the lumbar plexus, the rest all is supplied by the femoral nerve. Now, the medial compartment muscles, we have gracilis and adductor muscles. The all muscles, they're called the adductor muscles, and they're supplied by the medial nerve, and that is the obturator nerve. The posterior compartment, we have four muscles, two semi, one semi-tendinosus, one semi-membranosus, biceps femoris, and part of the adductor magnus. Now you can see that adductor magnus is having two parts. One is on the medial compartment and one is on the posterior compartment. So we call it as a hamstring part of the adductor magnus. So now what are the hamstring muscle? We have semi-tendinosus, semi-membranosus, biceps femoris, and hamstring part of adductor magnus. And they're all supplied by tibial part of the sciatic nerve, except biceps femoris, which is supplied by the peroneal nerve. Now, this is again a very important structure in the anterior compartment of the thigh. That is the femoral triangle. This this anterior compartment of the thigh is a area for what? For the femur. So everything we call it as a femoral. The triangle which is formed here also we call it as a femoral triangle. So what you have to know in the femoral triangle, how it is formed. It is formed from the medial side, lateral side. The base is by the inguinal ligament and apex is by where there is the sartorius and the adductor longus. They join together, they form the apex. How the roof is formed and how the floor is formed. Remember, the floor is formed by the four muscles. That these are the muscles: iliacus, and this is psoas major. Then we have the pectineus and the adductor longus. These four muscles are forming the floor. Once we have asked this question, that muscles which form the floor of the femoral triangle. So now go tomorrow and explore about the femoral triangle. See the triangle, see the medial border, see the lateral border, see the different content of the femoral triangle, as well as see the muscles forming the floor. It's very important. Just go and identify these muscles, identify the iliacus. Then you can see the psoas major. Then you will see the pectineus. See, the pectineus is coming from the pubis bone, and it is attached just below what? Just below the lesser trochanter. Lesser trochanter is for the attachment of the iliacus and psoas major, and just below this you will see the pectineus. And then we have the adductor longus. So it is sartorius, it is adductor longus. This is the base by the inguinal ligament. Apex is here. Now, what are the content? Content is all femoral, like femoral artery, vein, femoral nerve. There is femoral sheath, inguinal lymph nodes. So you have to memorize all these things. Now, just below the apex from here, there starts the canal, and this canal is called adductor canal. So what are the boundary of adductor canal here? See this, this is the adductor canal here. So on lateral side, we have vastus medialis. Above it is by the sartorius, and below it is by the adductor longus. So this canal is formed. What do we have in this canal? The femoral artery, vein, saphenous nerve, and nerve to vastus medialis. The femoral nerve is not coming here. Rather, saphenous nerve, which is a branch of the femoral nerve, is coming to this adductor canal. Now you can also see this adductor canal. Once you see the femoral triangle, go to the apex of the femoral triangle, and from there you can go to the adductor canal. Now, as I told you that just above the posterior compartment of the thigh, that is the hamstring muscle, we have the gluteal region. And the gluteal region muscles are divided into two group of muscle. One is called gluteus muscle and one is called short muscles of the gluteal region, that are the lateral rotators of the thigh. So what are the gluteus muscles? They are maximus, medius, minimus, and tensor fascial lata. Where is the origin of these all muscles? Now see this. Go to the hip bone. Go to the posterior part of the hip bone. We have one is your ischial, and ischial tuberosity is for the origin of the posterior compartment of the thigh, that is the hamstring muscle, semitendinosus, semimembranosus, and biceps femoris. And above the ischial tuberosity, we have posterior surface of the hip bone. So in the thigh, we have the posterior compartment of the thigh that is coming from the ischial tuberosity, and just above the posterior compartment, we have the gluteal region. So the muscles of the gluteal region, they will come from where? From the posterior surface of the hip bone. And then we have this short muscle, that is the piriformis two gemellus, uh, gemellus superior, gemellus inferior, and in between these two, you will see the obturator internus, and then we have the quadriceps femoris. Tomorrow, when you go to the lab, see all these muscles, the gluteus muscles, and also once you remove this gluteus maximus medius, you will see the short muscle. Mainly, you will see the piriformis. It's very important to identify the piriformis because it's a piriform shape. And from the lower border, you will see that there is a big nerve is coming, and that is your sciatic nerve. So this is how to identify the piriformis muscle. This is just above the sciatic nerve. And deep to the sciatic nerve, you will see these muscles, two gemelli and quadratus femoris. So this is your task for tomorrow. Go and identify these muscles. Now coming to the compartment of the leg. Again, we have what bones we have? We have two bones. The medial bone is called tibia and the lateral bone is called fibula, and they are joined together by interosseous membrane. And then we have three compartments. We have anterior posterior compartment, and then we have the lateral compartment here. We don't have the medial compartment in the leg. In the thigh, we have anterior posterior and medial compartment, but in the leg, we have anterior posterior and the lateral compartment. So this is the difference between the thigh and the leg, that in the leg we have the lateral compartment and in the thigh we have the medial compartment. Now, what muscles do we have in this compartment? Anterior compartment is the dorsiflexion and the extensor. So anterior compartment muscle, they are extensor muscle. The posterior compartment muscles, they are flexor muscle, and the lateral compartment muscles, they are coming from only from the fibula. So we call it as a fibularis. We have two fibularis here. We have the fibularis longus and fibularis brevis. Remember that the fibula is also called as peroneus. So don't get confused with this. That sometimes you will see that the muscles are called peroneus muscle or the muscles are called fibularis muscle. So we have one long, we call it a peroneus longus, and one short, we call it as a peroneus brevis. Okay. Now let's see the anterior compartment muscle. The one muscle which is coming from only from the tibia, that is we call is anterior to the anterior compartment muscle coming from the tibia, we call it as tibialis anterior. Then we have one muscle going to the big toe. We call it as extensor muscle because all anterior compartment muscles are extensor muscle. We call it as extensor hallucis longus. One muscle going to the digits, we call it extensor digitorum. And then one muscle which is on the most lateral and that is coming from the fibula, we call it as peroneus. Peroneus yani fibularis. So you call it as a fibularis, it's also okay. So let's see it. We call it as peroneus tertius now. Tertius means this is the third muscle which is coming from the peroneus. We'll see what are the other two muscles. Now, what nerve we do have? We do have in the anterior compartment, we have the deep peroneal nerve, which supply the anterior compartment muscle. Now let's go to the posterior compartment. Posterior compartment is the most thickest compartment in the leg, and it is divided into two groups, superficial group and the deep group. The superficial group of muscle, they're called calf muscle, CALF, calf muscles. And what are the muscles? We have gastrocnemius because it looks like the stomach. We have soleus, remember the soleal line, and then we have the plantaris. So these are the three muscles in the superficial group, and they're commonly called as calf muscle, and they have common tendon that is called tendocalcaneum. And the deep group of muscle are like the flexor muscle opposite to the anterior compartment muscle. So we call it as flexor hallucis longus, flexor digitorum longus, and tibialis posterior. Now, apart from these three, we have one more muscle here that we call as a popliteus. Now, what is the meaning of popliteus? Popliteus is posterior to the knee. So this is only limited to the upper part that is posterior to the knee. So we call it as a popliteus. It is not coming to the sole. These three muscles, they are coming to the sole, but this muscle is not coming. This is only limited in the upper part of the knee, upper part of the leg, around the posterior part of the knee, that we call it as popliteus. And for these all compartment, these muscles of the posterior compartment, the nerve supply is by the tibial nerve. So we have anterior compartment, we have the posterior compartment, and then we have the lateral compartment. Lateral compartment is taking origin from which bone? From the lateral bone, and that is the fibularis. One is long, one is short. We call it fibularis or peroneus longus, peroneus brevis. And what nerve we have? We have superficial peroneus nerve. Then you have to just know about it because we don't have the specimen can see all the muscles of the foot. So in the muscles of the foot, we have four different layers. Uh, we have first layer, second layer, third layer, and fourth layer. The first layer and the third layer, these two layers are intrinsic. That is, all the muscles here, their origin insertion is only in the sole of the foot. And the second and the fourth layer, they are mixed. And some muscles are intrinsic, some are coming from the leg. So you can see these four muscles. What are the muscle in the first layer? There is the flexor between two abductor. What are the abductor? One going to the big toe, we call it abductor hallucis. One going to the small, we call it digiti minimi. And in between these two, we have flexor digitorum brevis. Remember, the flexor digitorum longus is coming from the posterior compartment of the leg. So these are the three intrinsic muscle in the first layer, a flexor between two abductors. Now, second layer, we have two intrinsic and two extrinsic. Extrinsic means they are coming from the leg. So what are the intrinsic muscle? We have one quadrate plantar and one lumbricals. Lumbricals are very, very important muscles. So you have to know about the lumbricals, how many lumbricals we have, what is the action of the lumbricals, what is the nerve supply of the lumbricals. So what is the nerve supply of the lumbricals? The first one is from the medial plantar nerve and the rest is from the lateral plantar nerve. And the third layer again is intrinsic. Here we have an adductor between two flexor. What flexor we have? We have flexor hallucis going to the big toe, called flexor hallucis brevis, going to the digit, we call flexor digiti minimi brevis, and in between these two flexor, we have adductor hallucis. And the fourth layer is the introiti, like your palmar introiti. We have here dorsal and plantar introiti, and two muscles coming from the leg. One is called peroneus longus, and one is called tibialis posterior. Remember, the peroneus longus is in the lateral compartment of the leg, and this is in the fourth layer of the sole. Now, what are the nerve supply? You can see that the, in the leg we have two nerves. The tibial nerve, once we enter the sole, it divides into two nerves. One is the medial plantar nerve and another is your lateral plantar nerve. So you can see that one star is for the medial plantar nerve and the rest is your lateral plantar nerve. Like first lumbrical is on the medial side, it is supplied by the medial plantar nerve, and second, third, and fourth, it is supplied by the lumbricals, by the lateral plantar nerve. What is the action of the lumbricals? Flexion of the interphalangeal joint and extension of the interphalangeal joint. Flexion of the metacarpophalangeal joint and extension of the interphalangeal joint. So you will see the attachment of the lumbricals. They are muscles of the sole, but they are attached on the extensor surface. So you will see their attachment is a very unique. That's why it has two different kind of action. Flexion of the metatarsophalangeal joint and extension of the interphalangeal joint, similar to the lumbricals we have in the hand. Now, what is the major artery in the lower limb? Is the femoral artery. So you have already seen this femoral artery, which you will see in the femoral triangle. This is continuation external iliac artery, and then you see the course here. It crosses this inguinal ligament. This external carotid artery become femoral artery, and then we have three superficial and deep branch here. It continues here, and it is called popliteal artery, and then it divides into anterior and posterior tibial artery. Anterior tibial artery becomes the dorsalis pedis artery, and the posterior tibial artery enters into the sole of the foot. What veins we have in the lower limb? We have two set of veins, like veins of the upper limb. We have the superficial vein and we have the deep vein. Deep veins are like artery. Which artery we have? We have the femoral artery. Similar to the femoral artery, we have femoral veins, we have popliteal vein, and then we have anterior and posterior tibial veins. So the deep veins are always like the artery. Now, superficial vein, we have two different kind of superficial vein in the lower limb. They are called the great saphenous vein and the small saphenous vein. On the medial side of the foot, we have the great saphenous vein, and on the lateral side, you will see the small saphenous vein. Now, here you can see the great and small saphenous vein. This is the dorsal venous arch. And from the medial side of the dorsal venous arch, we have the great saphenous vein, which is passing anterior to the medial malleolus, and on the medial side, then going back of the knee here, then again coming to the thigh, and finally it drains inside the femoral vein. So this is great because it is present in the leg as well as in the thigh. This is on the medial side. From the lateral side of this venous arch, we have the small saphenous vein. Now see, it is passing behind the lateral malleolus. So this is the difference here. It is passing anterior to the medial malleolus and it is passing posterior to the lateral malleolus. Then it is ascending on the back of the leg, and then finally it drains inside the popliteal vein. Remember, this femoral vein here become the popliteal vein. So it enters and drains inside the popliteal vein. So this is a small saphenous vein which enters in the popliteal vein, and the great saphenous vein which drains inside the femoral vein. Then we have three nerves in the lower limb. You have already seen these nerves. These are the femoral nerve, which is in the anterior compartment. We have obturator nerve and we have the sciatic nerve. The femoral nerve is a branch of the lumbar plexus, and this is their root value. Anterior primary rami of L2, L3, L4. This is one of the largest branch of the lumbar plexus. It supplies what? It supplies the muscle of the anterior compartment of the thigh. Then it gives medial and intermediate cutaneous nerve. And it also gives the saphenous nerve. You remember the saphenous nerve in the adductor canal. So the femoral nerve is not passing in the adductor canal, rather it's branch. Which branch? The saphenous nerve, which is a cutaneous branch. So saphenous nerve is a branch of the femoral nerve. Then we have the sciatic nerve. This is what I was telling you, that this is the branch of the sacral plexus. This is L4, L5, S1, S2, S3. Now, how to identify this is the largest or the thickest nerve in the body. So once you cut or remove the gluteus maximus and the medius muscle, you will see this muscle. This is the piriform muscle. It has the upper border and the lower border. And you can see that from the lower border, a thick nerve is coming out, and this nerve is the sciatic nerve. It is where it is. It is on the back of the thigh, and it has two components. One is your tibial, which is going back to the leg, and one is your common peroneal. This common peroneal is passing close to the neck of the fibula, and it is dividing into superficial and deep peroneal nerve. The superficial peroneal nerve supply the lateral compartment muscle, and the deep peroneal nerve supply the muscle of the anterior compartment of the leg. So this is again the sciatic nerve here. This is sciatic nerve. This dividing into the common peroneal and the tibial. Common peroneal is going anteriorly, relating to the neck of the fibula, dividing into superficial and deep peroneal nerve, and the tibial nerve is going behind, and then it enters the sole, where it divides into the medial and the lateral plantar nerve. The common peroneal is dividing into the deep peroneal nerve, which is passing anterior to the leg and supply the muscles of the anterior compartment of the leg, and the superficial peroneal nerve is passing the lateral compartment of the leg and supply the muscles of the lateral compartment of the leg. That is the peroneus muscle, peroneus longus, and peroneus brevis. The obturator nerve. Now, how to identify these two nerves, the femoral nerve and the obturator nerve? Both are coming from the lumbar plexus. Both are anterior division of the L2, L3, L4. The root value are the same. Now, how to differentiate between these two nerves? There is a major muscle that we have already seen, that is the psoas major muscle. So once you go tomorrow to the lab, just see the psoas muscle, psoas major muscle. So psoas major muscle, it has the lateral border and it has the medial border. So we see medially there is a nerve coming, that is obturator nerve, and laterally there is a nerve coming, that is the femoral nerve. So lateral to the psoas is femoral nerve, and medial to the psoas is obturator nerve. So you will see this nerve is coming from the medial border of the psoas, and then it enters the obturator canal, and finally it comes out in the medial compartment of the thigh. Similarly, the femoral nerve is coming from the lateral border of your psoas major muscle, and then it enters the femoral triangle, that is anterior compartment of the thigh. So all the anterior muscle, they are supplied by the femoral nerve, and all the medial muscles, they are supplied by the obturator nerve. So this is what we have today. This is, very small, like only 25, 26 slides. And we try to cover your all lower limb. Things you have to know. The, the most important objective is to know about the different muscle group. So what are the muscle group here? Starting from the gluteal region, we have the gluteus muscles and the short muscle, that are the lateral rotators of the thigh. So you have to know from where these muscles are coming. The gluteus maximus, medius, minimus, and tensor fasciae lata, and then we have the lateral rotators. These are in the gluteal region. Then we have in the thigh three compartment: the anterior compartment, the medial compartment, and the posterior compartment. So you have to know about the origin, insertion, of supply, and action of these muscles. In the leg, again, we have three compartment: the anterior compartment, these are the extensor muscle, posterior compartment, and the lateral compartment. Lateral compartment, they are the peroneus muscle, and they are everters. As I told you, that eversion is the movement of the lateral compartment, movement of the lateral side of the leg. So this is done by the lateral muscles. So what are the lateral muscle we have? We have peroneus longus, peroneus brevis, and peroneus tertius. And inversion is done by the medial muscles. What medial muscle we have? We have tibialis anterior, tibialis posterior, and extensor pollicis longus. Now see, tibialis anterior and tibialis posterior, they are in the anterior and the posterior compartment of the leg, but they are on the medial side. So what is the function of tibialis anterior? Tibialis anterior is extensor, that is dorsiflexion, and inverter. So the tibialis anterior is having two action because it is placed anteriorly. So the major action is the dorsiflexion or extension, and it is placed medially. So it is also the inverter. Similar to that, the tibialis posterior, because it is present in the posterior compartment. So the main action is the plantar flexion, that is flexion. And because it is placed on the medial side, another action of the tibialis posterior is the inverter. So the common action of tibialis anterior and tibialis posterior is that both are inverters of the foot. But anterior is the extensor and posterior is the flexor of the ankle joint. So these are the muscles of the leg. we have the anterior compartment muscles, which are the extensor muscle. From medial to lateral, we have tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Now, the most lateral muscle of the anterior compartment is the peroneus tertius, and the most medial muscle is tibialis anterior. Now, in the posterior compartment, we have superficial group and the deep group. Superficial group, we have three muscles. They are called calf muscle. They are gastrocnemius, soleus, and plantaris. And this is attached through a common tendon that is called tendocalcaneum to the posterior part of the calcaneum. And the deep group muscles, they are the flexor muscle. They're called tibialis posterior, flexor hallucis longus, and flexor digitorum longus. So in the leg, you have to know four different kinds of movement. In the foot and the ankle, you have to know four different kind of movement. These are the dorsiflexion, plantar flexion, inversion, and eversion. How to do these movements and what are the muscles which produces these kind of movements. So this is what we have today for the lower limb. Very important is that you go to the lab and you can see all this structure by yourself and explore it. Try to find these muscles, try to see the bones, and try to do the movements by yourself. Then you will learn about the anatomy of the lower limb. It's not very big, but if you will see the structure, it's become very easy for you. So this is what we have. If you want to ask anything, or else we can close the session now. This, thank you very much.